Hey everyone, welcome to the very first episode of Flow Knows. So I'm Charlotte and I am a women's health physio, and this is Jason, my co-host, who is a musculoskeletal physio. We wanted to start this podcast to share our 25 plus years of clinical experience with everyone, and also wanted to start something that encompasses physio, rehab, pelvic floor, sport, and parenthood all in the one place. So we thought we might start by introducing ourselves. So firstly, I might ask Jason some questions. So Jason Horton is a physiotherapist and exercise physiologist. He's a multiple practice owner and he has over 15 years experience as a physio. He's also a dad to 4 beautiful little kids. Fun fact, Jason is married to my cousin, so we are pretty much family.
Yes.
So we're together all the time. Jason is within our family, and I'm sure all of his friend group as well, a wealth of knowledge with anything to do with the human body. So everyone asks him questions about all of their injuries and issues, and he pretty much knows everything. So, hey, Jason.
I don't know about that. Thank you for that introduction, Char.
So let's get started. So what originally drew you to exercise physiology and physio?
I started when I was playing sport. When back end of school, I knew that I wanted to stay in something around sport. So naturally, it kind of went into the exercise science world originally, and I got into the exercise and rehab at Wollongong. And then at the end of that, I was also like, well, I don't know if I'm going to go down that path. So I sort of said I might as well jump into the physio side, and then did the extra couple of years to do physio. But originally, and it still has been, is just my love of sport that got me in there.
And what would you say is the reason you are so passionate about strength and rehab in particular?
Oh, I think strength, particularly, if you look at it across the lifespan, it's the one thing that, if you look at all of the diseases, not all of the disease, if you look at disease in general, if you look at illness and chronic illnesses and things that do pop up so much in life, that strength tends to be the thing that kind of can affect a whole host of things. When you talk to anyone that's like elderly pop, the more strength and the better you are in your earlier life, the better your later life tends to be as well. So I just think there's so much in that kind of consistency of having a good strength training program.
Yeah, 100%. I feel like that is the number one thing as everyone's getting older. That's the biggest tip, is to not stop strength training.
Yeah. I mean, it's interesting because we do a bit of work with the aged care pop now in one of our businesses. And the biggest thing in life is, like, if you want to stay in the home, if you want to stay independent, you need to be able to get up and down from this chair, get up and down from the toilet. And if you lose that, that's when you lose your independence. Yeah. And that's when you need someone. That's when you need more care. That's when you start thinking about transition to aged care facilities and things. So it's one thing that helps you with your sport, with your life. You tend to be in it for like other reasons, maybe when you're younger, for looking good, feeling good. But it is if you're training and you've got good strength, you've usually got a good kind of handle on what life's going to throw at you. So
Very true. What do you see people getting wrong with exercise and recovery? What's probably the biggest thing people do wrong?
a lot of the time, I think from what I see, it's whether it's postpartum or if it is like injury rehab, it's always a lot of the time too much too soon, or a mismatch of their kind of expectations of where they're at and what they want to be doing and where their body's at. So I think a lot of the time we see people trying to get back too much too soon, or they get a big kick of motivation, say in the new year period where they want to start running a marathon or they want to start training again, and all of a sudden they go from 0 to 5 sessions a week. Is it me?
Yeah.
I swear I put it on D&D. What was the question? Sorry, just leave it. Going 0 to hero. Like if you go from nothing and then all of a sudden you train in 7 days, or you're decided I want to do a marathon prep in 6 weeks and you want to go to the Gold Coast, people try to fit in too much too soon, and they forget about how much or how important recovery is in that training process. They'll just overload their stimulus, and then they don't give enough time to recover, and then that's when things pop up: bone stress injuries, energy deficiency stuff, tendon issues, whatever it is. They just go too hard too soon.
And that's when they're generally coming in to see us.
Yeah, that's right. And then you have the hard conversation of like, I don't think you're going to be ready. Like, if it's too close, you've got to kind of set expectations. So that's what I see a lot. That's what people getting kind of wrong, but that's why we exist, I guess, too.
Yeah. So you're a dad to 4 kids.
Yep.
So how old are they now? And if you had to say how your kind of physical exercise and activity was impacted when they came along, what would it be?
Yeah. So Ava's turning 9 in December. Flinny's turning 7 in August. Jude's turning 4 in July. And then Lily's just 10 months. So it's it's busy. And I was just talking to Trav and saying that there's something on every day of the week. You've got other kind of responsibilities, and going from no kids, being able to train whenever you want, eat when you want, sleep however long you want, and you don't kind of really, you're not aware of those changes when the baby comes and you've got to be up overnight. All of a sudden you can't be going to your usual training session. So with 4 of them, it's harder, but just because we're busy. But it's kind of like you've really got to find time to fit it in, because otherwise it gets away from you. And I think especially with our 4th being born, our kind of, my routine training wise just went out the window. So it's just about finding the times that, for me, not take away from the kids too much. So it's usually early morning or late night, or during the day at lunchtime if we can, if they're at school, and trying to kind of at least fit in a few sessions a week. But I feel like as soon as the babies start to sleep again, that's when you start to feel like you come out of that newborn haze. So that's starting to happen now.
Finally. What do you do? Like, what's your go-to training throughout the week?
So I've been doing jiu-jitsu for about 10 years now. Haven't progressed very well through jiu-jitsu because of my consistency, but I love, if I can get at least one session of that a week. We do a Friday morning session that we've been doing pretty consistently down the beach, which is a bit of like conditioning and body weight stuff. And then again, probably not as good with my strength training, but just getting at least sort of 1 or 2 decent strength training sessions in the week. That would be ideal. If I can fit in surfing, if I can fit in golf, that would be great. But
Georgia might not let that happen.
It's a big list, yeah.
Okay, so if we think about being a dad of 4, what surprised you the most about pregnancy and postpartum recovery?
I think just there's a big expectation, I think, postpartum for women just to kind of get on with it. And I think a lot of the time, especially if it's your firstborn or things like that, that there is a lot of healing that needs to happen. You've got all of the kind of tissue healing, whether it's a natural birth or a cesarean. You've got different pathways of kind of healing tissue-wise. Throw in the complexity of trying to deal with a new baby as well, sleep routines, feeding, trying to breastfeed if you're breastfeeding, trying to figure out why they're not sleeping and if they've got any issues. It's a huge load that gets put on the mum and the dad, but particularly the mum, who's just been through a really beautiful event, but it is taxing on their body, and the expectation that everything's going to be all right, just get on with it, I think is a big thing. It's more than just like the 6-week recovery, I think. So a lot of people think like, oh, at 6 weeks you'll be fine, go and do everything. But as you know, and as I now know, being exposed to the women's health side of what we do, there's so many things that exist past that kind of initial birth phase that often don't get talked about, or historically women haven't kind of sought out help for, that kind of might just get pushed under the rug and they've got to keep going.
Yeah.
I think it's a challenge. It's a great time, but it's a super challenging time. And I think the more you can support the mum and the family, the better. And people always say it takes a village, and it does. If you've got a good support network, then you can make it easy, because it's a challenging time.
If you had one tip for a new dad to support their partner at this time, what would it be?
I think just be present and be there. I think it's not always sometimes you can't be doing the things that need to be done, like breastfeeding at night, but being there to support your partner or your wife or overnight, and being there just to kind of be a helping hand, it takes a lot of pressure off. And I think often if you're going to work and then you're coming home and you've had a tough day, but you spend all day with a newborn, it's not an easy ride. It's not a cruisy day. So I think being there and just being that helping hand and helping where you can, and obviously it's challenging because you're sleep deprived, you might get at each other and things, but I think just being present and offering that helping hand is my number one tip. Is, as a dad of four, I'm like, if you can just be there and help where you can. It's the little things.
Does it get easier by the fourth, or is it harder? Because two's hard.
I don't know. I look back at, I was talking to Georgia the other day, and I look back at number one, and you've just got no idea.
Yeah.
So you literally got no idea. Georgia, we always laugh because we were living in Colonel Road, and it was day one back from the hospital, and Georgia was like, I'm going to put Ava in the pram and I'm going to walk to the shops and I'm going to do the shopping and I'm going to get everything done. And it all just turned to shit, where she pooed in the aisle. She couldn't carry all the groceries.
That's right. She called Dane, my husband, crying.
Yeah.
Because he was the only one that could help her.
We always laugh about it because it's I guess the expectation to get on with it, and I'm going to be out and about and kind of walking with the pram, but it's hard. And I think it gets easier in the sense that you know what's coming.
Yeah, you know what you're doing a little bit.
I always think sleep deprivation is a form of torture, right? And I think so there's that period of 6 to 12 months or whatever it is whatever your baby's doing, that is really tough because you've got broken sleep. And we know from a recovery point of view that you are much, much better when you're got your full 8 hours sleep, but you're there to make sure that this baby stays alive, and you're giving so much of you because they can't fend for themselves. You've got to be getting up and feeding them, and it's always going to be hard. But whether or not it's harder first or fourth, I think you just know what you're in for.
I reckon that's a hard stat for new parents to hear, all the sleep stats and, how much lower sleep you get, your risk of injury is so much higher. And
exactly. Yeah.
That's tough because we know we're not getting sleep at that time.
Yeah. And again, you need good support. I actually was at jiu-jitsu 2 nights ago, and there's the guy that I was training with who's got a 10-month-old as well. And he was talking about they're going to Possum Cottage and they've been kind of trying to get the sleep sorted. And Georgia and I use a Mothercraft nurse at one of our local kind of GPs. And we've used her for every kid. And she has been a game changer since Ava, because they help you with routine and feeding and structure. And Lily wasn't sleeping until she was up a couple of times a night until last week, and we went and saw her, and she's like, "No, change this."
And she's been sleeping through?
And then she slept through that night. And then you're like, if you need that support, even with us, we've got 4 kids, but we still need that support.
You forget though, I reckon.
You forget. I reckon you just put it in a part of your brain that forgets that
blacks it out.
phase. All right, so Charlotte, women's health physiotherapist, Pilates instructor, physio for over 13 years. mum of two, and I guess some may or may not know also, e-commerce founder with Flow Women. You bring your expertise in, obviously, the pelvic floor, Pilates, physio, and motherhood. What made you become a physio in the first place?
Um, so I always wanted to be a sports physio. That was my goal, which is very different to what I do now. I was a really sporty kid, so I played hockey, touch football, Oztag, surfed,
Surfing.
snowboarded, skied. I loved all sport, and I had the vision of being a physio for the Sharks team or the
Yeah.
Origin team or something like that. So that's what got me there. And then, yeah, it took a different path.
I feel like everyone starts off on the sport.
Yeah.
Like it's like you get into physio, like I'm going to be the sports physio for someone.
Because you're injured, you maybe get injured as a kid and you see a physio and then
Yes.
you see what they can do. But yeah, that's why I went to uni and studied it.
So talking through that, what inspired the transition or the kind of women's health pathway that you ended up on and now have
So
been in?
I started to, I worked in a private practice clinic and I got really interested in Pilates. So I did some Pilates training and started teaching. And then with that came women's health clients. So
Yeah.
people would come and do Pilates when they were pregnant and postpartum. And that really interested me. So I started to do a little bit of research and training. But really the main thing was when I fell pregnant with my son. So
Yeah.
9 years ago now. And it just opened up my eyes to what our bodies have to go through.
Yeah.
And then I had a pretty, like a hard birth and a hard recovery. And pretty much from that day, I saw my own pelvic floor physio and I was just like, that's what I want to do. And that's all I've done ever since.
And that's now that started when it was after Geordie was born.
Yeah, so like I did some training when I was pregnant.
Yeah.
And then after he was born, I was like, that's all I want to do. I was fascinated by it through my own recovery and
Yeah.
rehab and just researched everything really for myself and my own healing. But then
Yeah,
I just
then you
became obsessed with it.
Apply it to your
Yeah.
clients. So now that you're in sort of the pelvic health world, women's health world, what surprises you most about pelvic health?
I would say I was shocked when I first started working in it with just how common all of the issues are. So it's so much more common than people talk about or think. Like if we look at the stats, 1 in 3 women have urinary incontinence. It's as high as 1 in 2 will have prolapse symptoms in their lifetime. Fecal incontinence is actually 1 in 8 women.
Is this postpartum or is this
Just
general?
just general. And they're just extremely high numbers.
Yeah.
You know, everyone's going to talk about your ACL injuries and, your health conditions like diabetes, but no one really talks about how common the pelvic floor issues are. So that was kind of the thing that shocked me the most was, wow, these women are just suffering.
Do you feel like there's been a light shone on these issues now, or do you still feel like it's like a taboo kind of subject?
I think it's definitely better now than
Yeah.
9 years ago or 10 years ago. I think social media is amazing with that because people are starting to
Bring
know,
awareness
and
things.
know that they're not alone. But still, they think the stats for things like fecal incontinence would be even higher because women just aren't talking about it. So there's a long way to go, but it's getting
One thing that
getting
I
there.
notice kind of being in the clinic is a lot of the generation previously, like maybe our mums and things, a lot of them will say that, oh, it's much more common to seek treatment now
Yes.
than it was
Yeah.
in their day. And that might be a generation of women that have gone and dealt with these issues just silently
Yeah.
without seeking treatment. And I guess that's part of what you offer now is that there's a lot of treatment for these things if you're just pointed in the right direction.
Yeah. And if we start treatment early, you just have such a better chance when you're going into kind of perimenopause, menopause, where if we start and we can kind of preempt and try and stop these issues from happening. Because a lot of my patients, they come in, they're postmenopausal, they start to have all these pelvic floor symptoms, and I'm like, we maybe if they had help, 10,
Yeah.
20 years ago, maybe it wouldn't have happened.
Yeah. Oh, definitely. So being a mum of two, how old are the kids now?
So Geordie is 8 and Chili's 5. She's
Yeah.
turned 5.
And now that you're become a mum, you're a mum of two, you've got this busy life, how has that affected what you do in the clinic?
I definitely think for my patients, I have more empathy for both their
Yeah.
injury, but also their time. And I understand that, getting their rehab done is hard.
Yeah.
And I think being a mum has definitely made me a better clinician for
Yeah,
sure.
for sure. It means in that way with like rehab and things, it's like having strategies that
Yeah.
like you're faced with challenges of time and kids and life, fitting in, having good strategies around fitting in their rehab and what they need to do.
Yeah, exactly.
What do you think most women are unprepared for with regards to their body for pregnancy and postpartum?
I would say most women are unprepared for labor. Like they don't understand exactly what's going to happen.
Yeah.
They're not educated on the process, which
Yeah.
then makes it really hard for them to make kind of those informed decisions at the time.
Mm.
And I think they're unprepared for the length of recovery. So like
Yes.
you were saying before, it's not just 6 weeks and you're better.
Yeah.
It really, tissue healing is, we know it's longer than that. It's probably more like 3 months plus.
Yeah.
And a lot of women just don't know that.
What do you hope to see in the future of women's health? What do you, in the women's health world, women's health physio, what do you hope for the future of?
I hope that everyone, no matter what their economic status is, that they can have access to women's health physio
Yeah.
and pelvic floor screenings in pregnancy, and then at least some postpartum follow-up physio. In countries like France, they have, 10 subsidized free sessions for
Interesting.
women, which that's what we're kind of advocating for
Yeah.
because we know it's so important.
Yeah. And I think if you think of long-term health and well-being, it's such a important part to recover and to be functioning how you want to in that postpartum world, like life. So going back to your mum of two, what's your current exercise routine? I know you mentioned all those sports
Yeah.
initially. I know you're still doing a few. How's this changed since being a mum?
So it's taken me probably now, like this is like my 9th year of being a mum, to finally get into a bit of a rhythm and a groove. I found actually exercising postpartum really hard logistically. Like just you have a baby, it's really hard to take them when they're meant to be sleeping. So I always did kind of some home workouts and personal training, but I never really got into the groove of it. Whereas this year I do personal training twice a week. I do a home Pilates workout once a week, and then I play hockey on the weekend.
Nice. Are you still surfing?
Oh, I would love to be surfing, but logistically,
Once a year in Byron, maybe?
yeah, when I'm on holidays, it's easier. But I always think, I'm like, when we can just leave the kids at home and they'll be okay by themselves, I can get back into it.
Yeah, soon. You know what though? The father time is like, it's crazy to me how, like, I'm staring down the barrel of 40 next year, and I remember mum's 40th, and I'm like,
Yeah, that's scary.
I feel like you kind of just turn into like your parents and things, and like
We thought that was so old.
but you still feel the same, and you like have this real kind of realization, I think, or like gratefulness, compassion for your parents, because you're like, oh, they were just where where I am now.
Yeah.
Yeah, it's interesting. So I've got a few kind of questions for you around pregnancy. It's one of the biggest physical changes that the body goes through. How do hormones affect joints, ligaments, and connective tissue in the pregnancy period?
Yeah, so I would say, pregnancy, postpartum, and then menopause are the biggest changes in a female body. So hormones, we have relaxin, estrogen, progesterone, are a few of the main hormones in pregnancy. And essentially, one of their roles is to soften and stretch the ligaments in the pelvis to try and prepare a woman's body for labor. So they've got to be able to push the baby out and get the baby out. So these hormones are affecting ligaments and tissues, but it's not just isolated to the pelvis. So we have ligaments throughout our whole body, and we often find that during pregnancy, women get aches and pains and they just feel sore because these ligaments are stretching everywhere. And then that's why they generally come in, see us.
So talking about everywhere else, what happens to the abdominal wall as the baby grows through pregnancy?
So the abdominal wall essentially stretches. So you've got a piece of connective tissue which runs down kind of the middle of the tummy called the linea alba, and this attaches to our six-pack muscles. So the hormones are stretching this ligament as well because it's a ligament in the body. And as the uterus grows, the abdominal wall stretches out, and that's where women get ab separation. A lot of women in the clinic come in so afraid of ab separation and so scared during pregnancy, but it's actually a 100% normal part of pregnancy. It just means that your body's stretching, doing the right thing, preparing for birth and the end of the pregnancy. So you don't need to be scared of it.
Yeah.
We just need to teach you how to manage the load through your abdomen, through your pelvis, so that we can protect you kind of postpartum and stop you from getting all of the back pains and pelvic pains throughout pregnancy.
And I guess talking about the linea alba and the ab separation that they see, what do you look at postpartum for mums?
Yeah, postpartum, in those early phases, the abs just slowly start to come back together for most women. So most women in the first 6 weeks, hormonal changes, tummy goes down, the abs should come back together. But generally at about 6 weeks when we do a postpartum check, we will check both the width of the abs but also the depth and just see what that tissue is doing and the integrity of the linea alba. And then from there we can write a rehab program if we think you need to work on it.
Yeah. Are there any times when it's like a big flag, like if there is a major separation or kind of a big depth? Is there anything that you're looking at that might kind of raise the flag that you are concerned about, or are they usually just going on that same rehab pathway?
Yeah, generally if the ab separation is more than, I would say, 3 centimeters and I could get my fingers in quite deep, then that's a little bit of a flag that we need to start doing some core program and loading it up, because the research really tells us that we have that first few months to make the best change. So that first few months we have hormonal changes. We want to be doing the rehab then, which is the hard part for women because, as we were saying before, that's the time where you're sleep deprived, you're trying to look after a new baby, your head's in a fog. And on the other side of that, it's the best time to make change in the abdominal wall and tissues. So it's, I find that is a hard balance because you don't want to overwhelm the woman and say you have to do all of this, but it's the most beneficial time.
I guess just educating them that this is the ideal time to be kind of looking after it. So I guess what we tend to see in the postpartum kind of classes and things is that where like prescription is really important.
Yeah.
Because you'll see if you're in a class or if you're looking for it, you'll see some like some coning or doming in the abdomen that may suggest that we need to drop back and kind of scale back or improve what we're doing from a exercise prescription point of view. Is that what you see? Is it?
Yeah. So pretty much every woman's going to be different. So what one person can do at 6 weeks postpartum, another person might not be able to do that until 12 weeks postpartum. So us assessing that and then giving you a rehab program that is really progressive is the best way to improve your function.
Yeah, and I guess it's the art of what we do is like knowing how to scale back and improve what they're doing so they're not actually doing things that are out of their current scope a little bit.
Yeah, exactly. So kind of with like tissue adaptation, you need to push them to a certain point to make change. So we are looking for, like, you're allowed to potentially have a little bit of soft coning where at that point where we're pushing them. But if we're seeing, you know, their tummy going into a very hard coning, they can't control the pressure, that's too much. So we kind of have to have that really early on sweet spot, give them the exercise, and then we then progress that like a few weeks later, a week or two later, so they can get to that next point. So I see probably the biggest mistake people make with abdominal rehab is they're just on basic core exercises for way too long. You know, they're like 3 months postpartum and still doing basic loading, which is not going to be getting them the results that we need.
And I guess for the mum that's newly postpartum or something, maybe they just don't know what that next few steps are.
Exactly.
Right? So that's why it's important for that help, or seeing a women's health physio or someone that knows how to progress and when to progress and why to progress.
And they're often scared, like they're scared to do more.
Yeah, exactly.
So that's where we can guide them.
We always hear a lot about the pelvic floor. What happens to the pelvic floor? How does pregnancy affect the pelvic floor?
So if we kind of put birth aside, pregnancy alone has a lot of effect on the pelvic floor. So if we think about it, the pelvic floor is not just muscles, it's connective tissue and fascia. So if we go back to what we were talking about before with the hormones affecting the fascia, it makes the tissues more stretchy. So that fascia holds up the uterus, the bladder, the rectum. So if we think we then have, you know, baby's going to probably be over 3 kilos. The placenta is going to be around 1 kilo. We have all the amniotic fluid. That's going to be more weight. So we're looking at, you know, over 4 kilos sitting on that fascia and that tissue. It's a lot of pressure. Like if you go and pick up a 4 kilo dumbbell, like it's not light. Like it's actually quite heavy. So the way that I try and explain that to my patients is imagine a bowling ball sitting on a hammock. Like throughout the whole pregnancy. There's going to be a lot of stretch on the tissue, which we can liken to like the ropes holding the hammock up. And then the hammock would be like the pelvic floor muscles. So the bowling ball is just kind of sitting on it and putting stretch through it. So we want to have a really good pelvic floor in the pregnancy.
Yes, that's a good analogy. I know you've talked about that before, but I've never actually sat and thought about the 4 kilos of a bowling ball sitting on your pelvic floor. How do these changes then influence how the new mum that's out there should exercise during pregnancy?
So we just have to we just have to be mindful of these changes, but not, we don't want to scare women and say you can't exercise, because the narrative is complete opposite. We know that exercise is so beneficial for mum, baby, and we've come such a long way over this last, say, like 30 years. I remember I don't remember, but when my mum was pregnant with me, it was almost like no one should lift weights and no one should exercise. Whereas now we're telling pregnant women, you need to exercise, you need to do this. But we just have to be aware that there's changes happening. So there's the core changes, the pelvic floor changes, the ligament changes. So we just need to know when to modify, when to adapt. But my passion is to just keep people moving and exercising.
Beautiful.
Okay, so then if we look at pregnancy and postpartum more from like a musculoskeletal rehab perspective, what's actually happening postpartum that women might not be aware of?
Well, if we're leading on from our last discussion about the bowling ball and the 4 kilos, you think like pregnancy is like it's a 9-month kind of loading event, right? And then it all leads up to the birth, where it's a big physical event, whether it is natural delivery or C-section. You've got a big physical event that's going to affect a lot of soft tissue in the body and connective tissue. So I think one thing that we need to be mindful of is the recovery side of it for the mum, is that it's going to take time. When you think of it as a total load, what they've been through, what their body's been through, the changes they've been through, is that we can't just expect the body to magically kind of over a week or two to be back to where we were pre-pregnancy. So again, going back to like some of the clients that I work with, is that your body has you can't you can't mess or speed up healing time naturally. Like maybe there is some things that people do and some things going on out in the world at the moment, but when you think about it, you need to allow adequate healing time and recovery time, and then you need to think about how am I going to reload the body after something so physical and such a long loading event like pregnancy is. So it's about, when you think of injury in the MSK standpoint, it's you have a period of this, the body's not doing what it used to do. You may during pregnancy taper off a little bit. If you've been well or seen a women's health physio and you've got a good program that you're still training, you need to think about the recovery side, and then actually how are you going to progressively load it again to get back to the things you want to do. I think what people forget is that 3 kilo or whatever your bub that you've got is with you from day zero. So you've then got to be carrying, feeding, carrying shopping, pushing prams, going upstairs with bub. Like there's a lot of actual physical stuff that starts day zero. So allowing time to recover and then being realistic about how you're going to reload post pregnancy or in the postpartum period is really important.
Yeah. So I feel like running is so popular at the moment, and postpartum, a lot of women want to know from me when they can start running. We normally think of from a tissue healing time frame, regardless of other factors, that we probably should wait about that 12-week mark. So say a woman wants to go back to running and she maybe hasn't seen a physio, which is not what we want. But say she goes back to running and just runs, 7K straight away. What would you say the implications on her tissues and her joints and injury risk would be?
Well, again, if you take the load scenario and you think, okay, 7 kilometers off the back of not running maybe for a good 6-9 months is a big load that the tissues have to try to adapt or have to try to sustain. And what you'll find is that likely if their baseline level of fitness hasn't been at that level for the periods leading up, that they'll probably end up with some kind of injury. Maybe it's a niggly sort of Achilles, maybe it's some urinary incontinence, maybe it's something else with the hip. But usually if you're going too fast too soon or too hard too soon, that you're going to end up with something that's symptomatic. And we kind of like to say that symptoms are feedback, they're not failure, but you've just got to be smart about where you start on the ladder.
Yeah.
So understanding that you're going to have a ramp, not be where you were pre-pregnancy. You're going to be ramping up back to that, and just got to be smart about allowing the tissues to adapt. You've got to load them up again, let them recover, let them adapt, and then go again, and be consistent with that progression. But also just being mindful of the symptoms that you are experiencing, not trying to fight through things that are happening, and just maybe pulling it back, getting some advice on what you should be doing or where you should be starting and where's reasonable for where the body's at.
So how should a woman do that gradually? Like say if she was running 7K and, did that a few times and then was having knee pain or hip pain, how would she pull back?
In the postpartum?
Yeah, postpartum, or someone that's just started running.
Yeah.
They're a few years postpartum and they decided, I want to start running.
Yeah, I think things like if you look at something basic like the couch to 5K, or if your desire is to get to 7Ks, and I mean, I can't remember the last time I ran 7Ks, but if your desire is to get to a certain kilometers, it's just being smart about where you start, where your body's at, and maybe assessing kind of what the body can handle at the moment. And that may be through some smaller run volumes that you do to then go, okay, here's my starting level. I'm not trying to go 5 steps up. If we look at a stair analogy, you've got to start where your body can tolerate. And for me, it's always about, am I asymptomatic? Can I finish it efficiently, optimally? Am I not getting any 24-hour post soreness that's untoward, that's sharp, that's kind of not just muscle soreness? Finding where you are on that kind of staircase and just taking the gradual stepping points. So a lot of people will go, okay, I'm going to do a 5K I get it done, and then 2 days later they're thinking, I'm going to do 10.
Yeah, they
And you
felt
think
good
that's a
though.
that's a hundred
Yeah.
percent increase on what you've done, and it's just knowing where the body is at that time. Now, someone might be able to do that and progress. It might just mean that their starting point was too low. But more often than not, you'll find that people will become symptomatic somewhere if they're overloading too
Yeah.
quickly.
I've had recently a few patients come in postpartum that have had like bone stress, stress fracture injuries. What do you think that happens because of that load?
Well, I think it's part of it. I
Mm,
think what you'll find is it's a it's a multi kind of
complex.
it's a complex interaction. I think that what you find is, and it'll be person to person, but I think load is an important factor. If they're increasing loads too quickly, and they're not recovering well, then they're just putting too much stress on, say, the bones, where the bone starts to swell, it gets some edema in the actual bones, and that's your continuum to a stress fracture. But you might add in the postpartum, particularly, that throw in the bub's not sleeping overnight and
Yeah.
you've got a broken sleep and you're not getting adequate recovery and you're trying to load the same, then all of a sudden your recovery timeline needs to be kind of spread out a little bit more. You also then throw in the complexities around like wanting to get back to their body and sort of this pressure that may or may not exist
Yeah.
socially to like, I'm going to get my body back to where it was as fast as I can. And
They
I think
push too much.
what I tend to see a lot is probably an underfueling of like women or men generally, especially if they're chasing sort of fat loss. Everyone's talking about calorie deficits and things.
Yeah.
But if you are underfueling your body, you then do not have the building blocks to build the muscle tissue, the bone tissue in that adaptation phase or that recovery phase. And then you have things that if you don't have adequate fuels, you could talk about kind of the relative energy deficiency
Mm.
syndrome that a lot of women kind of
And
uh,
postpartum, they're going to
might
be at
see.
risk.
Yeah,
Yeah.
postpartum, and that's part of that whole. If you look at it, like it may be a bone stress injury, or it could be that their cycles out of whack and hormonally that they've got some hormone dysfunction because of this whole kind of complex interaction of loading too much, not sleeping, not recovering, and then not adequately fueling. And multi system sort of areas may start to fail, but they may present as kind of some hormone issues or some bone stress issues. But if you scale it back or look at it under the hood, you're like, well, what if we improve their recovery by not loading them too quickly? What if they're not eating kind of or refueling as much? And we know in the postpartum period, we talk about healing. You need to actually eat.
Yeah,
You need to actually
exactly.
fuel the body. So it's an interesting kind of area that we see a lot with the running
Mm.
kind of and in postpartum. But I think, yeah, some education around that energy deficiency and recovery and just load is critical there.
Yeah, it's so important. So I thought we might say a few myths that we hear when we're in the clinic. So I'll start off. So my first myth is that leaking during pregnancy is normal and it will just get better. So this one I hear all the time. Women will come in and see me and they're like, "Oh, I'm leaking, but that's normal. I'm pregnant." But it actually isn't. So you shouldn't be leaking at any time. And in fact, we know from the latest research that if a woman leaks either prior to pregnancy or during pregnancy, they are at significant risk for leaking postpartum. So the numbers are about 30% of women that leak at this time, so before or during pregnancy, will be incontinent in the postpartum period. And then it's about 47%. So that was in the first 3 months. And then about 47% by 18 months postpartum will be urinary incontinent. So the numbers are super high, and we don't want to just fob it off as, oh, we're pregnant, it's normal, because it's actually showing in pregnancy that your baseline tissue and pelvic floor strength is obviously low, and pregnancy is just putting you kind of under that threshold. So if you're pregnant, we want to work on your pelvic floor to make you not one of those stats.
Right. One thing that the big myth that we always get as like physios is that you should always stop if you've got exercising, if you've got pain. And that's a reasonable kind of thing to do. But we know that pain doesn't always mean damage, that kind of there's always options for you. So one thing that we always see is like, oh, say it's in post-op rehab, or if it's just post-injury, it's like they might be able to do a squat and not get knee pain, but then a lunge kind of hurts them, or like a split squat or something hurts them. It just means that, again, it's feedback for us. It's not failure. It means that we just need to find an area for, or a regression that the person can actually do until they're ready to progress to that. So it's not always stop and just heal and don't do anything, because the deficits that you get from just not doing anything are probably worse than continuing.
What would you say there's the kind of on a pain scale, we look at, there's like the green
Yeah.
numbers, the yellow numbers, the red numbers where we should stop. What are they?
Well, I guess for us in the clinic, in my experience, we always talk about the 0 to 3 out of 10 pain as being okay, the green area. If it's kind of more than that, 4 to 6, you're like, okay, maybe we need to start thinking about changing what we're doing. And then anything above that that's in the red, we're like, okay, we need to not do that, and we'll pull back into something else. But it's all, I look at it like, if you're rehabbing someone, or if you're coming off an injury and you're like, this is something that you can't do, I always look at it in a frame that's good rather than negative. Because if you're coming back from an injury and you're like, oh, I can't single leg hop yet because it's too sore, you're like, okay, that's good. We've got really good information that your body's you're not quite ready for that load. We need to spend a little bit more time at the level that you are capable at to then build toward doing those things. So it's often, in my context, it's like, it's a good thing that we've found that, because we need to keep you on your rehab pathway.
That's like a nice way to frame it, because a lot of people just have pain, get scared, stop.
Yeah.
And then that's just a vicious cycle.
And it's always in our world, it's like, for us as physios, we've got to handle that kind of objection or that kind of fear that the client has. Because if you don't, if you're just like, oh, okay, stop that, we won't do that, let's go sort of thing, you kind of need to say, why is it happening? What's the context of the injury or the individual? This is what we can do about it. This is what would likely happen. This is how we're going to get back there. So I think it's important always to address it.
Yeah. So let's finish then with just a few really quick fire questions.
Yeah.
So, Jason, what's one exercise that almost everyone should do?
I think about this in the context of like longevity, and I would have said walking. Like, I just think everyone should walk.
Getting your steps up.
But in the context of longevity, I think, like we talked about before, if you can do a squat or a sit to stand or some form of like knee extension strength, I think long term, your ability to get out of a chair dictates independence. Just depends on what life stage you're at. And also, your leg strength is a really good indicator of future kind of well-being and health. So I would say maybe just squat or do something, because it's
squat.
accessible. You don't need to be in the gym. You can do it at home. You can grab some items at home to make it heavier and harder. Take it to a level of fatigue. So from a sets and reps point of view, I think if you keep building leg strength, I think it's an important one for the future. So I might hang my hat on that.
Squats. What's one thing partners should know about postpartum recovery?
Say that again. Partners?
Partners. Yeah.
That it takes time. So don't have expectations that the body and your partner is going to be kind of ready to do everything that they were doing quickly post birth. It takes time. There's so much that's going on in that time when we've got a newborn. So I think realizing that it's going to take time to get back to kind of where this new life is.
Yeah.
So,
and what's the biggest mistake you see people make with returning to exercise after time off? Load can't be the answer because we've spoken about it. What's something else?
after time off, too much too soon is the is the answer. Knowing that if you've had time off, that you're just not going to be at where you were before your injury or whatever the time off that you've had. I think just that knowledge in itself will give you a better starting point to save you from injuries. All right, quick fire questions. Charlotte, one pelvic health myth you hear every week.
One would be that if you have prolapse, you can never lift weights or run again. We know that that's just such outdated advice, and there is so much we can do to try and get you back to doing everything you like doing.
Nice. One thing every pregnant woman should know.
How to both contract and relax their pelvic floors.
How do you relax a pelvic floor?
Oh, that's that's a lot, but a muscle pretty much has to be able to switch on and off. So we need to teach women how to activate it using their breath, and we can use ultrasound in the clinic to try and give them some feedback for it. Lots of mobility work, but yeah, relax is equally as important as the contract.
When should someone see a pelvic health physio during pregnancy?
So they can see us anytime throughout the pregnancy, especially if they've got pain. They can come in, as early as in the first trimester. If they just want a pelvic floor screening and they're not really having too much pain or concerns, then generally about 20 weeks. And then we'll take them through an assessment and what they need to work on.
Perfect. All right. If you've made it this far, thank you for listening to our first episode of Flow Knows. Make sure to follow the podcast, share it with someone who you think might benefit from it, and look out for the next episode.
Bye.